mon portable devant moi.
J'avais perdu trop de sang. Surtout que je voyais rien, j'avais du sang dans les yeux. Il me mettait la main sur le crâne. Ça faisait...
Les cadeaux d'Arros vont bien?
J'ai plus rien, j'ai plus bon caleçon. J'ai plus de téléphone, j'ai plus de papier, j'ai plus de manteau, plus de chaussures. J'ai plus rien du tout. Le gars, il m'a foutu à poil sur le trottoir.
On a de la chance quand même d'être encore là.
Il y a
Ça aurait pu être pire.
Il y a eu 4 morts. Hein.
Ouais.
Enfin, vous étiez très gentil, mais j'ai envie de rentrer chez moi. J'ai envie de dormir à la maison, dans mon lit, et de voir ma famille, mes amis, leur dire que ça va.
J'étais content pour lui déjà qu'il puisse partir déjà. Mais bon, j'aurais bien aimé partir en même temps que lui. Et ce voyage commence à être un petit peu fatigant. Et j'ai quand même hâte de rentrer chez moi. Malgré la très bonne compagnie que j'ai autour de moi.
You know, it's a horrible situation for Victor because he wants to go home. We always try and do what our patients would wish us to do, but there are times where we just can't do that. We've got to wait until we're comfortable and confident that he will be able to breathe without the chest draining before we can let him fly.
Stephen is no longer sedated and has been moved out of intensive care.
And were you just in London for the day, or was it your birthday on the day? Oh, Stephen.
I remember making the decision, let's cross the bridge, get a taxi on the other side. That's pretty much it. My wife was there as well.
Oh, is she okay?
She has minimal physical injuries. She has a twisted ankle and a few bruises.
Right.
But she remembers it, and I don't.
You don't remember it?
So, I've got the broken body, she's got
It's
the
got
broken
the broken
mind.
mind, I know.
I'm not really worried about her.
You know,
It's trauma,
it's
literally.
horrendous.
Cara told me there was an image online of us, so I went looking for it. This is it, really. This is me laying in the road, and Cara's just kind of on her knees, crouched over me, telling me to be okay and it's all right. I just see love in it, really, because all that chaos and hatred, all I can just see is my wife looking after me. But we're going to deal with it together. So we've kind of... That's our plan, you know, we'll both do it together. And so, like I say, we've got different experiences of the situation.
You okay for coming? Do you remember me? So I was going to chat to you a little about the leg. You know, getting the operation done to fix both the bone and the soft tissue that's missing. Yeah. So the whole aim of this is trying to get rid of any chance of infection, which could...
Do it once and do it well once, and that's it.
That's exactly right. Yeah. OK, the other thing I always ask people is, are you having problems sleeping, flashbacks, anything like that?
Let's get this sorted.
Yeah.
Then we can cross that bridge when we come to it.
So just so you're aware, you know, if you do start getting those kind of things, it's completely normal.
Just want it over and done with it.
But if you want someone to talk to, we've always got people around. You know, our aim is to get you back to where you were. okay, you've got to get into his head that actually it's not going to be a smooth journey. He's going to have rough days, bad days, it's going to go up and down. He might be walking down the road in 6 months' time and hear a car revving, and it may just somehow subconsciously flicking back into where he was on the day of the accident. And I think it's important to warn people that can happen. Every one of us has a limit to how much mental resilience we have, and you've just got to be conscious of that.
Bonjour. Ça va? Can you give me a big cough? Big breath in. Looks good. I think we can take that out. We're going to remove the drain. Once the lung re-inflates and expands, it sticks to the inside of the chest wall, and that keeps it up. Just taking out a stitch. Okay, in again. And blow hard. Okay, done. Done. Breathe normal. Okay. Très bien. Good. Do it again.
Okay, we're going to take a quick picture of your chest, yeah? Get your shoulders very close forward. Okay, Victor, big breath in for me, please. And breathe normally.
Je me sens déjà un peu mieux. C'est une chose de plus de faite et une épreuve de moins à traverser pour entrer à la maison.
Yeah, his lung is nicely expanded. His collapsed lung is nicely sealed, so he could be discharged today.
Même si on aime beaucoup l'hôpital Sainte-Marie, on aimerait bien repartir à la maison rapidement. Retrouver notre petite vie tranquille.
Bonjour.
Paramedics from the French insurance company arrived to collect Victor.
Ah, le problème, je vais pas te mentir, c'est pas trop douloureux. Hein, voilà, là on va aller sur la route. Tu risques d'avoir un tonnerre. D'accord?
Bon, la préoccupation, c'est qu'il se remette bien et qu'il n'ait pas de séquelles physiques et psychologiques, voilà, qu'il reste voilà, toujours le même, toujours la joie de vivre.
Ça va me faire plaisir de rentrer chez moi. Là-bas, je pourrais retrouver ma famille, mes proches. Et j'ai quand même passé un excellent séjour, bien que la fin ne soit pas passée comme prévu.
Victor, all the best, man. Okay.
I walked across Westminster Bridge yesterday, and it is so mundane. I know exactly where our patients were injured. Sometimes it's almost surreal to think that actually a week ago it was a very different scene.
It's the day of Stephen's leg operation.
About six, 8 months ago, we got married, and that's it. We're just a happy little unit, really. We live like our lives like anybody else. We go to work, come home, watch a bit of TV, have a bit of dinner, and go to bed. This will change us. We're going to appreciate each other more, and for both of us to survive. That's just... You take it for granted. You step out the door every morning and on your merry way you go.
The operation is the start of his rehabilitation, the start of his journey back towards getting to being that person he was before he got hit. You know, if we can now say to him, right, Stephen, you're fixed. Your next focus is walking out of the hospital. Yeah, that's a big deal.
Are you ready, Stephen?
I am. I don't know if that's going to be the last of it. I'm not expecting it to be the last of it. I want him back home. I want to have a Friday night on the sofa with a pizza and a beer, you know? I want that back.
Right, there we go. This is our titanium nail that's going to stabilise the fracture.
The operation will last 9 hours. First, an orthopaedic team inserts a 390mm rod into Stephen's shin to stabilise the fracture.
OK, X-ray please.
Then, Shahan attempts to repair the large open wound.
See, the leg break itself is relatively straightforward. The problem for him is that it's happened in the context of losing lots of skin around the leg break. So we need to replace the skin that's been lost using tissue from his other leg. And the way we do that is we take a block of tissue on its blood vessels. We then move it to where that skin is missing. So it's slightly robbing Peter to pay Paul, but we're hoping the robbery is worth the outcome. And then we reconnect that blood vessel, 2 blood vessels in his legs, using microsurgery, so it's kind of quite delicate stuff. If we can't get that connection to work, then we've got a problem. Yes, that's all now hooked up. So you can see this tissue is now bleeding. And ideally you want it bleeding exactly the same as it was when it was in the thigh. So hopefully, after today, he's going to be on the road to recovery and walking and getting back on with his life, at least from the physical side. I'm also sure that other things will take a bit longer. Right. Ah, good.
Here he is, the magician himself.
How are you?
How are you? How are you?
I'm all right.
How'd it go?
Went really well.
Out of 10?
Probably 12. That's basically, that's as good as it could be. Cara, hi, Shauna actually, I'm the surgeon looking after Stephen. He is awake, comfortable, and he wants to go dancing. So I think that's probably a good sign. No, it's a pleasure. Take care. Right. Bye-bye. Bye. Our job here within our trauma centre is to deal with victims of trauma, no matter how they've suffered that. It's important to reflect, but it's also important to realise, you know, we all have jobs to do. We have to move on from this, and we have to, keep going.
Adult glucose in a minute, guys. I want to do this as a log roll.
I'll come down. Where are you? In resource? Yep, coming down.
What's happening?
I don't know, but I know there is a bad stabbing down there.
Salut. Ça va? Comment venu visiter Londres? Nous, on n'avait rien fait.
Cette expérience m'a montré qu'il faut profiter de la vie un maximum. Donc je remercie vraiment l'hôpital aussi pour m'avoir aidé.
I can't wait to have that first kind of beer in the garden. I feel like I'm allowed to say we've won. We survived and we're safe.
My heart hopes that you only ever have one day like that. My head tells me that I'll be putting on that tabard again. And that sense of almost inevitability is something that you just have to get used to.
Next time.
So let's move on to the income report.
With the NHS under mounting financial pressure,
we have a financial deficit of 41 million.
The Trust treats private patients to boost income.
It's better that we address our deficit that way than that we have to cut back on NHS services.
And with patient demands for new, expensive cancer drugs rising,
we are in a golden era of more and more drugs available. How do you cost life? It is very, very difficult.
An increasing number of self-funding experimental treatments.
If it even gives Glenn something to live for now, it's serving a purpose.
What choices would you make when faced with complex healthcare decisions? Visit our interactive pages to find out how you would respond. Go to bbc.co.uk/hospital and follow the links to the Open University.